This is the video of laser URSL, that is ureteroscopic lithotripsy, in a left lower ureteric stone. Here we can see that this is a stone which is very hard in nature, and most likely it is a calcium oxalate stone based on the color of the stone. Now this is a laser fiber, which is a 550 micron laser fiber with a holmium laser. The energy is delivered at the tip of the fiber with the light, and with the help of the energy we are fragmenting the stones. The fragmentation is done in the dusting mode, and therefore we can see that the dust is very much clear. And this technique is known as a painting technique, where we are painting the laser energy over the stone, leading to formation of very fine dust. Our idea is not to break the stone into hard and large fragments, because if we break it into very large fragments, it will go up and into the ureter. So here we are using this so as you can see that we are continuously dusting the stone. The debris of the stone is making the urine, that is the inside the ureter, little bit hazy because of this dust storm. So if it happens like this, then we have to wait for some time, at least for 2 to 3 seconds, for the dust to clear. It usually clears. Now there are various advantages of URSL, which is done by laser. The first advantage is that there is minimal retropulsion. Therefore the chances of stone going up into the kidney is very less. Second is that because the laser fiber has got a very high energy, it can dust every bit of stone which is very hard. For example, if the HU is around 1400, that is a 16 stone which cannot be fragmented by pneumatic easily, or there is a very high chances of the stone going up into ureter. In those cases also, the laser energy performs much better. Thirdly, because as you can see here, because there is very much less injury to the mucosa, there is no bleeding from the mucosa itself. However, in pneumatic lithotripsy, there is sometimes bleeding from the mucosa because of the directly injury from the lithotripter. So, and the best thing is that very hard stone and very large stone can be cleared in only one setting, and the patient can go home on the same day itself. It can be a daycare surgery. And another advantage is that it can be done in patients who are in pregnant patients. In pregnant patients, if there is a lower ureteric stone or a upper ureteric stone and it needs removal, the best time to do is laser URSL is the second trimester. Here we do not use any X-ray, we use ultrasound with minimum anesthesia, safe anesthesia. We fragment and dust the stones and put a DJ stent, and after that we remove the stent after 1 month. So it is considered very safe in pregnant patients, if at all the stone needs removal due to presence of excessive symptoms. Additionally, laser URSL can also be done in children. For example, less than 12 years. Suppose if a stone is located in the ureter which is not coming out easily, so in those cases, with very small scopes, we can do the laser URSL. Now here we can see the stone has been cleared in quite a small amount of time, and these are the various small dust. We are removing the dust at last, and we are checking the ureter now. So the procedure time taken for the procedure is around 10 to 15 minutes. Upper ureter is normal. There is not much impaction at the ureter, the junction where the stone was lodged, as you can see. So this shows that the laser URSL is very advantageous in all kinds of stone in the ureter, be it large as 2 cm can be removed without a need for open surgery or laparoscopy. So as you can see here, at last there are very few fragments, and these are coming out with the help of the pressure of the water, that is the normal saline. We'll make sure that we don't keep any dust or any fragments there. If there are large fragments, then we have to remove it by a grasper. So the procedure is almost complete. As you can see, the stone is removed and there is no bleeding. So this is clear. So that will be all. Thank you.